Greetings, I am Manandhar, Clark, Atlanta University, Department of Mathematical Sciences, Atlanta, Georgia, United States. I am going to present on dengue virus infection during window period of consecutive outbreaks in Nepal and assessments of clinical parameters. Introduction. What is dengue disease and virus? Dengue disease is a tropical disease. It's a vector-borne disease and transmitted by the mosquito Aedes aegypti and Aedes albopictus. Its severity case is less than 5% and convalescent period is 10 to 15 days. Dengue virus belongs to the family of Flaviviridae and it has four serotypes: dengue 1, dengue 2, dengue 3, and dengue 4. It is a single-strand RNA and it has approximately 11,000 kilo base pair. Dengue symptoms are fever, eye pain, muscle pain, headache, bone pain, nausea, joint pain, and rash. Trends of dengue infection in Nepal. The first case was known in 2004 with a Japanese traveler, and it is reported in Takasaki et al. 2008 paper, and that was a genotype 1 and the serotype dengue 2. Dengue outbreak every 3 years since 2010. The outbreak was 2010, then 2013, and then 2016, then 2019, 2022. The dengue serotype was alternating between dengue 1 and dengue 2. Now, the threat of potential outbreak in 2025, which is the next year. Objective. The study period is between the two outbreaks, 2016 and 2019. So we have the samples from 2017 and 2018. And we studied the geospatial study of the dengue expansion in different regions of Nepal from tropical to temperate. And in classification, we perform phylogenetic analysis to understand the evolutionary linkage. And in hypothesis testing, identification of the biochemical markers of dengue diagnosis. So we have the dengue disease versus the control. Methodology. Samples. We have the 76 samples, dengue patient 61 and healthy control 15. And we collect the samples from the hospitals. And the collection period is September, October, and November. These are the months for the peak months for dengue epidemics. And we excluded the cases if the patient have the HIV or the children less than 5 years and pregnant women. The tools used are the molecular diagnosis, real-time PCR tests, gene sequencing, hematological and enzyme analysis, and the statistical analysis, phylogenetic analysis with the BEAST. Variables used are the platelets, AST, ALT, hematocrits, and hemoglobin. Hypothesis tests are parametric and non-parametric tests are done. And for the parametric, we have the assumption test for the parametric. And the significant variable, we build a logistic regression model. Geographic distribution. It is the official data 2022. And we can see from the left map that dengue is more found in the eastern tropical region, and then it is spread to the central hill regions. And in 2022, the temperate region has a 70% dengue, tropical has a 16, and subtropical has a 14. By the month wise, the peak months are after the July, so it spread more in the August, September, and October. Demographic and geographic distribution. Previous year's sample studies. Following graph has a samples study from 2017, 2019, and 2022. The line plot shows that most of the population affected are the younger age group from age 20 to 40, to 45, and uh, the bar plot shows that in 2017 there is high frequency of the population affected in the tropical regions, and then in 2022 high frequency are affected in the temperate region, in the hill region. So it shows the shift of the dengue infection from tropical to the temperate region, and it is mostly affected to the younger age group. Sample study 2017 and 2018. This sample study is between two outbreaks 2016 and 2019. We have the samples from the tropical region in 2017, 33 samples, and the 2018 2 samples. For the temperate region, we have the samples of 14 and the 12. In total, we have the 61 dengue samples. And in the left, there is a map of the Nepal shown where the India in the south and the north China, and bordering to the India we have the tropical areas, the Terai belt, which has the altitude of 59 to the 1000 meter, and in the middle we have the temperate regions, so it has the altitude from 1000 to 2000 meter, low mountains, and the middle and high mountains 2000 to 5000 meters, and in the north there is high Himalaya greater than 5000 meters. Circulating serotype in window period as detected by real-time PCR. In year 2017 in tropical Tarai area, dengue 1, dengue 2 and dengue 3 was seen in 2017, and 2018 dengue 2 is seen, and in temperate hill regions only dengue 2 is seen. Phylogen tree of dengue 1 genotype V. So phylogenetic analysis is with the beast, and dengue sample is from 2017 for Nepal. This phylogen tree shows that the sample from Nepal is found to be close with the sample from the India. Phylogen tree of dengue 2 genotype cosmopolitan IVA. For the dengue sample 2017, cosmopolitan IV of dengue 2 was close to the Indonesian dengue. Data availability. The gene sequence of the envelope protein obtained in this study was deposited in the gene bank with accession number given here. Comparison of clinical parameters on hematology and hepatoenzymes. For the healthy control, we have the 15 samples, so it has small samples. For the parametric test, we test the assumption of the normality. Normality test is done by the Shapiro-Wilks normality test, and the normality test shows that platelets, ALT, hematocrit, and hemoglobin normality assumption is true, but not for AST. Assessment of clinical parameters for prognostic markers. Below it is given the bar plot and the summary statistics for platelet, AST, and ALT. For the healthy patient, mean platelet count is 288,000, and for the dengue patient, it is mean platelet is 105,000. So platelet count is reduced significantly for the dengue patient. And for the AST, the mean AST count is 25.9, and for the dengue patient it rose to 71.1, and for the ALT the mean count for the healthy is 36.3, and for the dengue patient it rise to 76.3. Now the platelet is the hallmark biomarker, and AST and ALT are associated biomarkers. Comparison of the clinical parameters on hematology and the hematoenzymes. Following table shows the hypothesis test for the two independent populations. Here we have the parametric Wells T test and the non-parametric Mann-Whitney test. We have done the test for platelets, AST and ALT in this table here, and the p-values are given. Both the parametric and non-parametric test shows that a significantly low platelets count, very small p-values you can see there in dengue patients than the p-values for AST and ALT. Platelets are much stronger indicator with significant support by AST and ALT to discriminate the dengue patient. Following table shows the hypothesis test for the two independent population for hematocrit and hemoglobin for parametric and non-parametric. This test shows that hematocrit and hemoglobins are not significantly different between healthy and the dengue patient. Logistic regression for significant variable platelets. Following table shows the output for the simple logistic regression for the significant variable platelets. The coefficient is a negative here and odd ratio is less than 1. A negative coefficient or the odd ratio less than 1 shows that decrease in platelets increases in the probability of being a dengue. By increasing a 1000 unit platelet count decreases 2.72% odds of being dengue. Logistic regression for significant variable AST and ALT. Following table shows the output for the simple logistic regression for AST and ALT. Both of those regression has a positive coefficients and odd ratio greater than 1, and the positive coefficient shows that increase in AST or ALT increases the probability of the dengue disease. 1 unit increase in AST increases an average 10.06% odds of being dengue patient. Similarly, 1 unit increase in ALT increases an average 3.46% odds of being a dengue patient. Conclusion. Multiple serotypes were found. Phylogen tree shows that the dengue 1 genotype B is similar to those found in India, and dengue 2 cosmopolitan IVA is similar to those found in Indonesia. Platelets are much more stronger indicator with significant support by AST and ALT to discriminate a dengue patient. Platelets have very small p-values compared to AST and ALT. Increase in 1000 unit platelets count will decrease in an average 2.72% in the odds of being dengue. Increase in 1 unit AST will increase an average 10.06% odds of being a dengue. Dengue is spreading towards the highline, hilly temperate regions. Dengue outbreaks has occurred every 3 years since 2010. There are total 5 dengue outbreaks: 2010, 2013, 2016, 2019, 2022. Now alert for coming expected outbreak 2025. Acknowledgement. Central Department of Biotechnology, Tribhuvan University, University Grant Commission, Center for Disease Control CDC, Georgia, USA, La Jolla Institute of Immunology, California, USA, Carias, California, USA. Here is a contributors list. Thank you for your attention.